awesome message come through asking me to give a talk about how a woman's body responds during the 9 months that she's pregnant, and also the effects of carrying a baby around afterwards. So it's a very good topic to talk about. So let's start at pregnancy. When you are pregnant, your hormones in your body change your body. So your body has to prepare for growing the baby inside, as well as for allowing the baby to come out the vagina during the birthing process. So your ligaments become lax and so that they can stretch. So because of this, and because of the shape of your stomach, it alters your point of gravity, and it can cause a lot of pain between your shoulder blades as well as lower back pain. And I'm talking about pain in this area here. We call it your SI joint. Now this is quite common in pregnant women. There's two things that cause SI joint problems. One of them is pregnancy. So if you start experiencing lower back pains, especially towards the end of pregnancy, it could be your SI joint. And the other one is falling very hard, altering your SI joint's position, which can then cause a lot of pain. So there are exercises in that we can do to improve that, and definitely going to see a physiotherapist will help. They often tell you can wear a SIJ belt. So it's just like a little belt, or like a elasticated belt that you put around. They call it the SI belt or a pregnancy belt, and that helps to hold the stomach up so that it's not putting as much strain on your lower back and your upper back, and that's actually quite good to do. The second thing that's very good to do is after the delivery of the birth is you get an abdominal belt that your doctor will give you, and it's basically also an elasticated belt that comes over your stomach that you can adjust. You also get it if you've had a hernia repair. You adjust it, and then it pushes your stomach back in and tight so that it can all go out, as opposed to just hanging out afterwards. Because after pregnancy, you lose your abdominal strength because it's been stretched to hell and gone, and that then has to be now re-assimilated into the body. And it takes 3 years for your hormones to return to normal. So it's a long period of time that your body is helter-skelter. So you want to make sure that you're doing the correct exercises. You can't do too intense exercises after the pregnancy again, because it can cause more problems, because your body is lax, your joints are lax and your ligaments are lax. So walking is good. If you've got an SI joint problem, you need to repair that first. Get your SI joint back into position. Your physiotherapist will be able to help you, and there are specific exercises that one can do that I'll run through perhaps in a different exercise or different video. So watch out for the SI joint video. That one will help you realign your SI joint. So you want to be able to do gentle stretches to prevent yourself from tearing during the birthing process in your vagina. Is you can use oils that you rub on the external area of the skin at the vagina to soften up the area and make the skin more pliable. And during the birthing process, at no point must you help with your hands down there, because you will tear. So allow the body to naturally adjust and to stretch, and then the baby will come out quite happily. Just one or two tricks that I've learned from the baby is when the baby is born, that umbilical cord, using Weckesin powder, WECESIN I think it is, or SEN, that you can get at your chemists. It's a wound healing powder. It dries up that umbilical cord very quickly. Within 3 days it turns into biltong and falls off. So very, very good to use. I found it much better than that liquid that liquid paraffin that they rub on, because that can sometimes make it go fraught. So the Weckesin powder works very fast for that. You want to make sure you're doing lots of stretches, watching your posture. Look, if you've got your baby and you're holding the baby and you're carrying the baby on the arm, the ulterior way you hold your body is going to cause a lot of back pain, lower back pain, and that. Do lots of stretches, keep yourself fit. Do arm exercises to strengthen your body, do back exercises to strengthen your back, and let's see what we can do. We've got to go now, so I will chat to you later. Hope this video has helped, but we'll make more like this to help you understand which exercises you can do. And like I said, go look for the SI joint video to see how to realign your SI joint. Have a great day. Enjoy your watching of the video. Like it if you liked it, and please send me WhatsApps or emails to tell me any new ideas that you have or would like to hear about. Have a wonderful day.